For this week's presentation on emerging technologies, I chose to look at mobile learning. I was kind of inspired by someone's presentation last week and was wondering what I could find to use in my classroom for respiratory care. So I searched on my phone for some apps that might be helpful to my students, and I was able to find one that was a free app for the students called X-Lung Assist. Now with this app, it actually works well with them for their mechanical ventilation class. They can use it out in clinicals to help them make sure they have the right settings for patients, to do some calculations and things that they would look at to make changes in the patient's settings on the ventilator. It has tips in there and different things that they could use. There's an online site for the computer which does a whole lot more, but I'm focusing on the X-Lung Assist, which is what they would have on their phones. So what I did is take some screenshots of what it would look like when they pull it up on their phone. And this is, you'll notice there's, 4 different things across the bottom. You have settings, and that's where they can change what units are used. You have X-Lung tips, and this is the first place I'm going to start out in. You have patient checklist, and then you also have the calculators. I really think the calculators are going to be the most commonly used function on this app. But under X-Lung tips, it talks about general indications for mechanical ventilation, initial settings that they would use for a patient, talks about gas exchange monitoring, and we'll look into those here in a second. But you'll see there's things that we're not going to be able to access, and those are the pro sections where you would need to upgrade, and that's where you're going to have to pay. But it's only $6.99, so I think that's actually a pretty cheap app for something that they could use a lot. So if we click on that general indications for mechanical ventilation, you can see it brings up a screen and it simply lists. This would be a reference page for students, letting them know, what those indications are. And it just talks about general indications, and then it goes down and looks at specific clinical and IVG criteria so that it can remind them of what those are as they're working with these patients in the units. Next, I'm sorry this gets a little small. I was having some difficulties with it, but the next thing is we scroll down on that initial settings page. It looks at where you would set different things using a tidal volume of 6 milliliters per kilogram of predicted body weight, using AC mode, so different modes of ventilation, where to set the initial respiratory rate. So again, these are guidelines. These are things that they have used in class, and just kind of a reminder to them. So then the next part down here is patient checklist. Here we can actually enter in a specific patient's data, their ventilator settings and parameters, and it will let the student know if there's any risks or things that they need to be aware of, maybe things that one setting doesn't go with another, just something that should kind of let them know that maybe there's a problem that they need to take care of. So here you can see we'd enter in, of course we're not going to enter a name in here because of patient confidentiality, but they can select male or female, put their age, height, altitude if we're at an extremely high or low altitude, otherwise it really doesn't make a difference. Pick what their actual diagnosis is, and then we start entering in their ventilator information and ventilator parameters. And then also the measure parameters, this would be their blood gas results. And then it will calculate parameters for them. So by entering all that information in, it'll tell them what their predicted body weight is, what their tidal volume should be based on that 6 milliliter per kilogram, and looks at a number of different factors here, airway resistance, PaO2 predicted. So there's a lot of different information they can get from this, which would let them decide whether or not they need to make some changes in those patient parameters. Now, my favorite part for this is the calculators. On this one, you can get that body weight again, and tidal volume settings, airway resistance, static compliance. As you can see, it is limited here as well. You'd have to upgrade to that pro version and pay the $6.99 fee. But again, it's just really not very much for all the options that this has. So for gas exchange, you can see what settings should be. This one here, respiratory rate setting for a certain PaCO2. They can take their blood results and enter them in, and it will tell them where to set the respiratory rate based on those blood results and what you want to change those results to. So in other words, if it's abnormal, it will select the normal result and tell you which way you need to change it, whether to increase or decrease the respiratory rate. So a lot of things on here. This is big in weaning, so if they're weaning their patient, that's a very important parameter to know, and it'll go ahead and calculate that for them. And then for the body weight and tidal volume settings, again, you're going to pick the gender, the height, and then it's going to calculate all of these for you. And this is where they're going to set their initial tidal volume based on these guidelines. And it also adds in some national standards in here. So it's actually a very up-to-date and meets all the national standards of care for respiratory patients. So I was pretty impressed to see that. And then here it's using ARDSNet, which is one of those national standards, and it gives you the formulas, it gives you the tips to make sure that you pick in this range for your tidal volume. It has references in here as well. So good resource for the students. I really think that they would be able to use this in clinicals. Here again, it looks at calculating airway resistance based on patient data and results. It'll also tell you whether or not that's normal, abnormal, and give you all the information you need to make decisions on care. Here again, looking at some airway resistance, and right here it calculates the results for you after entering that information. Gives you the formula as well, so they can remember what that formula is, because that is important. So that is mobile learning for respiratory care. It was an app I found for the students. I'm pretty excited about it because it's something, again, that even just using the free resource, they would be able to get something out of it. And it's something they can use at the bedside, which helps bring their classroom information out into clinicals and gives them some different options.